So how about you start by telling us a bit, I suppose, about the Ana Liffey Drug Project and maybe the work that you guys do there.
Thanks, Christina. Well, we're based in Dublin. We're also based in the Midlands and in the Midwest. We work with 2,500 people per year. We provide harm reduction services, we provide drop-in services, we provide stabilisation programs and other forms of group work and one-to-one work. We do a lot of work on outreach in the streets around Dublin and in the areas around the Midlands and the Midwest. And we work a lot in partnership with the other agencies, the HSE and such, and the Gardaí and all the other treatment services that we have to work in partnership with to find pathways for people.
Yeah, and so it's not just a Dublin project. This is about addressing the problem nationwide.
Yeah, for our, we're a national addiction service, and we do, as I say, work in those areas, and we would like to work in other areas where our work would be needed. There is a significant drug problem across Ireland. Clearly, Dublin does have, I suppose, a lion's share of the problem, but there's no doubt in anyone's minds that there is a well-emerged trend of drug use across the country.
Yeah. And I suppose the issue of drugs has been hitting the headlines. Recently, we have a new drugs minister. Is that something that you've been pushing for, and you guys would welcome the steps forward in that regard?
Yeah, I mean, we would welcome the appointment of Mr. O'Riordan to in terms of the national drug strategy, being responsible for the national drug strategy, and so would our colleagues in the community and voluntary sector. It was something that we've all been looking for in the recent year, and I think it's great that he's actually been put in responsible for the national drug strategy.
Yeah, and one of the things I suppose people have been discussing, and it's possibly been in and around the news for the past couple of years, is injecting centres for drug users. And I know you have written extensively about this, and you've been over to a number of countries that operate these centres. And I know you've written for us as well, particularly about the Sydney project. And maybe you could tell us a bit why you think it could work here in Dublin.
Yeah, I think if anybody uses the city for any reason, whether they live or work in the city or visit the city, it wouldn't take much time to be in the city to realise that Dublin, particularly Dublin, has a very significant public injecting problem. You can see that you might see the people themselves injecting themselves, or you may see drug paraphernalia unsafely disposed in alleyways or in public spaces around the city. So we know through being engaged with the different stakeholders, the different policy groups that we've engaged with over the last number of years, that we have a significant problem. There was a number of newspaper reports that well documented the problem we have. So what you have to look at is how are we going to solve, or not solve the problem, but manage the problem better. And I think that's probably a really important thing to say. This isn't something we can really solve. It is something to be managed better, and to be looking at individual areas and the problems that they have. So one of the issues part of the response would be medically supervised injection centres, and
this works in other countries.
Yeah. There's 90 services across the globe, in Europe and other parts of the world. I went to visit the Sydney service, the medically supervised injection centre in King's Cross, and had a really good experience there. I was working there for 2 weeks. They established the service in 2001, and they found that they managed to reduce with having the medically supervised injection centre, policing housing for people who were homeless, and more treatment and rehabilitation options. That approach meant that they were able to reduce the problem that they had in the area. So I walked the area in King's Cross. I would know where to look for people and where injecting sites would be. And I found no evidence of public injecting in the area, which suggests that most of the public injecting, or all the public injecting in that area, is going on inside the service. So it did have a positive outcome. I met with the police officers there, the officers who were involved in setting up the service. I met with police officers who currently manage the area. All of them were very supportive and owned the fact that they had a medically supervised injection centre in their area, and it just it just worked very well for the client group as well, obviously.
Yeah, because we've had a few questions in and read from our readers, and I'll just read one, I suppose, is, as you said, injecting, it's kind of, I suppose, in your face, and that maybe makes people more think of the issue and how to maybe have the solution. So one person got in touch and said, my daughter lives in Christchurch area in Dublin. She sees addicts shooting up all the time. I've seen them myself, and at times it can be quite scary. Last week she saw a man with his trousers down around his ankles shooting up. Now that's, you know, quite a horrific sight for anyone to see, but I suppose people are seeing this in our capital, and there's been, I suppose, a lot of criticism, whether even you're looking at the user's point of view, as in we need to have a solution, but also I suppose in terms of political or tourism, you know, it has a big impact on cities.
All of the stakeholders, the business groups, residents, etc., nobody is happy about the situation, least of all the people themselves who are injecting in the public domain. The problem we have is not that you know, anyone is happy about the situation. It is that we need to come to a conclusion on what we're going to do about it. I was up around Christchurch the other day and saw exactly the same thing. There is a problem there, but there are. I don't like to really mention the areas myself, because I think you know, there's a lot of stigma. There's a lot of stigma attached to public injecting, and it's difficult enough if you live in an area to have that happening than to be further stigmatised. So, I mean, you mentioned it now, so Christchurch is an area, but there are other areas, very well-defined areas around the city centre. I would say that every alleyway in Dublin is used for public injecting at some point during the week. You know, it really is that serious. Yeah,
and in terms of, I know the new drugs minister now, he hasn't necessarily pinned his colours to the mast about this definitely going forward, or, you know, but would your point of view be, is what other solutions, I suppose, are we going to use to address something like this?
I can understand why the minister would want to look at, you know, cautiously at this. It is a progressive move. The simple fact is that we can't open one up right now because it is illegal to provide a medically supervised injection centre in Ireland at the moment, and we have been working with the voluntary assistance scheme of the Bar Council, a group of barristers who are drafting legislation. They're meeting again this Thursday, who are drafting legislation that, if it was enacted, would allow for the existence of medically supervised injection centres in Ireland, and that's really the first step to address, because all the other discussions and interesting parts, I mean, you know, you need to address the legality of the situation first.
Another question we have in is from another reader who says, I live in the city in Dublin, and I used to work near a lot of areas where I would have walked by and seen needles on the street, and I've seen open dealing and injecting on several occasions. My question is, why is there not more political pressure to put safe injection facilities in these cities? This reader seems to think that would be a cost-effective measure and would drastically improve the problem. So that question seems to be towards the political will. Now, as you said, you welcome the new drugs minister, but is there political will from over your experience of the years? You know, do you need more people to get behind this?
Well, it's not something that's been implemented, so I can't say there's been political will to implement it. But I can say that it is an issue that people who work in this area are lobbying for. So certainly, Father Peter McFerry has called for the implementation of services, MSICs. Brother Kevin Crowley was mentioning the same thing as well recently, as has Tony Gagan from Merchants Quay. So, you know, people are looking for this. They do see it as the sensible thing to do, the right thing to do. I know that it does polarise opinion to some degree, but I do think that from the discussions we've had, from the frustrations that everybody who lives and works in or visits Dublin feels, that they want to try something that is proven to work, and the simple truth is and the evidence is very strong, particularly from Sydney. The reason I went to Sydney was because it has been evaluated by 9 different third parties, and has been found to work very, very well and be effective in what it was set up to do, which is obviously to address public injecting. So we'd like to do the same here. Yeah, and a few other questions, I suppose, coming in were more generalised.
some people were saying, centralised treatment. Is there enough facilities, I suppose, nationwide for people, and also concerns about possibly the criteria for people getting treatment for drug treatment. Do they have to be clean to get into a treatment centre now? Is there loopholes, I suppose, or barriers? I mean, that are that are causing issues?
We have a very, very significant problem with drugs in Ireland. We also know that things have changed and change constantly over the years as we work with people. So, firstly, yes, there are deficits in services, but in fairness to the people that I work with within the statutory bodies and the voluntary bodies, people are working towards trying to address that, particularly in the regions and trying to get services up and running with it, even at a time when services are being cut. We know that drug services in the voluntary sector have been cut by around 37% over the last 5 or 6 years. So there's been significant cuts to services, but again, it is the case that services have been trying to develop within those kind of restrictive ways.
That's not great, I suppose, in terms of political. Politicians coming out and saying they want to address if there's cuts. Are these things that need to be reversed if we want to really put a sort of a real weight behind solving the problem?
There's two things to be done. We need to look at what we are currently delivering as a sector and make sure that that's addressing the issue. And we do need to be willing at a political level to invest particularly in treatment and rehabilitation, because this is a health issue. It's not a policing issue, although policing is important. But we do need to see more treatment options for people, particularly residential treatment options for polydrug users. There is an issue around having to. The question was around being drug-free or reducing. A person does have to reduce their drug taking to access residential beds. There is a model in Glasgow, in the UK, in Scotland, where Turning Point run that service, and you can literally go up, be assessed, and if there is a bed, you will get in. It's based on how you present and your needs, and not about your level of drug use being a barrier to that to service delivery. Yeah,
and you mentioned there polydrug use. I know a lot of people there on our comment section were discussing the different types of drugs that were becoming an issue. Well, a lot of people were saying, heroin is a lethal and drug and serious drug. Is there a rise in other drugs, I suppose, that people might be seeing openly used on the streets?
Well, on the streets around Dublin particularly, we would notice people huffing butane gas, which has happened in the last number of years, maybe last 2 years, certainly something I've witnessed, and we've seen an increase in. So that's really kind of old school drug taking behaviour. It's very cheap. People can buy it over the counter and then as discreetly as possible they'll be gas sniffing, as it were, in the city centre. There's we've identified recently an issue with another drug, Lyrica, and we're just working on how best to advise people around that side of things and to raise those issues in terms of emerging trends. So we know that most, I don't really know anybody who takes one drug anymore. It is a polydrug problem, and we need to make sure that our services are able to cope. The kind of drugs we're looking at, heroin would still be a main drug of choice. Pills, benzodiazepines, Z-type drugs, high-strength cannabis, alcohol, cocaine, and what would have been known as head shock drugs. So a big cocktail, a big mixture of drugs that people are
so
taking.
It's not just one issue, I suppose, we have to deal with. Another question came in from one of our readers saying, are we over-relying on methadone treatment in terms of drug users? Well, it's great to see perhaps new initiatives of like injecting centres willing to tackle. Should we more be done in terms of rehabilitation in that respect? We're putting, I suppose, drug users on methadone long term. Have we been over-relying on that?
I think this has come up a couple of times in the media about people being on methadone for 10 and 20 years and that this is wrong. I just think that you have to be very, very careful about sweeping statements and macro picture about what is essentially a health intervention or medical intervention. We need to look at each individual case and make sure that that's right for the individual. So I just believe that from what I know from the research, is that methadone is very well researched, is very effective in terms of what it was designed to do, and kind of, I suppose, populist statements are dangerous, really. We just need to make sure we look at the individual and make sure that it's right for them, and be very careful about how we proceed around any kind of recovery agenda. I think that we need both. We need a harm reduction approach, which reduces the harm to drug users when they're active in their drug use, and then we need recovery and aftercare as well. We don't just need one thing, because one size doesn't fit all when it comes to drug use.
And we covered the issue of homelessness quite extensively in one of our series last year, and one of the things that came up and from our readers also that is that an intertwined problem, homelessness and drugs? I've discussed it with a few homeless people saying they've been put into positions where they're housed with other drug users when they're trying to do their best. Is this a big issue as well? That is something that needs to be, I suppose.
I mean, homelessness is generally is a big problem in Ireland, as we well know. There clearly, if you're street homeless, living in emergency accommodation, then there is good evidence that drug use and alcohol use is intertwined. Not everybody who is homeless takes drugs, but there is a significant proportion of people who either have had or do have a drug problem. Of course, there's difficulties if you're going to have people living in situations, or in communal situations around one person's needs versus another. That depends on, I guess, the management of the situation, and we have to trust that the service providers are able to manage those people and provide safe spaces for them.
And a question we just got in from one of our readers: why can't more money be invested in detox treatments and getting people off drugs? Why are we perpetuating the problem of drug injecting? Would a zero tolerance approach work to clear the streets and spend money on people going cold turkey? And that's from Darren in Raheen.
The zero tolerance approach to drugs doesn't work. It simply moves the problem around. We've seen that, not that we don't have a zero tolerance approach in Dublin per se. We certainly have the Guard working very hard to manage the situation through Operation Spire and Operation Peer, and we work very closely with the Guards. But it does really result, policing alone simply results in the dispersal of the problem, and we've seen that in the last 14 months, and where areas that formerly didn't have a problem now have a problem, and now we're having to manage that. There is good, strong evidence. The London School of Economics had a report last year that said we need to move our funding towards health-based initiatives and away from criminal justice initiatives for people with drug problems, because that's what works. There was another study in the UK that found that for every £1 that was spent on treatment and rehabilitation, you save £3 in the criminal justice system. So there is very strong evidence for that, but I don't think it's around zero tolerance that we need to do that. We need to police the situation, and we need to provide options for people. We're working very closely with the Gardaí. One of our outreach teams is out. We're working with the Dublin City Council, the Health Service Executive, and the Guards to provide outreach to the most vulnerable drug users who are coming to the attention of the Guards, to get them through to case manage and find pathways for them. We're case managing around 40 people at the moment, and that's since last September. So that's working really well, and we have Gardaí member allocated to that team, assigned to that team to work alongside us, which is very innovative and creative.
And I think you'd mentioned before that in Sydney you found that the police, it took the injecting centres, I suppose, took perhaps away from what the police have to deal with maybe at the moment here in terms of policing, and is it their role at all really to be looking at that?
Yeah, I mean, I met the police officers who had been there in 2001 to set the project and work with the provider to set the project up, and they were very, very positive about that. And I also I went to a community policing forum and met the local area commander there, and again he was very, very supportive. They talked about their MSIC, a real sense of ownership, and I think that they saw the benefits of the project in the community. The business groups also spoke. I met with a business leader there who also spoke very positively about the benefits to the area. Even though ideally you wouldn't have drug taking behaviour in an area, this was a lesser of two evils, really.
And what about people? In the comments, people have been maybe saying they welcome such initiatives like the injecting centres, but does it get down to the point where people welcome them but maybe don't want them in their areas? What sort of answer would you have to that? Like, in terms of communities, and they'd be worried about it, but is that a real concern?
Well, you only put a service like this. The evidence is very clear that you only put this into an area where you have a public injecting problem. So the answer is that people already have that problem in their area. This will address the problem in that area. That's pretty much the answer, really. You put it where it's needed.
Okay, and we just have another question in from Fiona Nathai, and she's asking in relation to the legalization of drugs now. In terms of, Richard Boyd Barrett has recently said that he thinks that all substances, including heroin and cocaine, should be legalized. And her question is the fact that drugs have been criminalized. Is that the problem here, or in terms of is this something that should be looked at?
It's a wider issue, obviously, than in terms of the work I do with drug users in Ireland. I suppose the minister did say that as he rightly pointed out, there is a national drug strategy, and that's up for review. And there's a consultation process going on, and that's where this kind of discussion and the wider discussions will come into play. For my part, I suppose personally, anything that would reduce harm to the individual, private and public harms. So to the harm to the community, anything that is cost effective and is efficient and effective should be looked at. But it's a very complex area.
Yeah. And as you said, you don't particularly want to mention specific areas, but one of our readers said there are a number of issues in and around the city centre here in Dublin. Particularly, she mentions the boardwalk.
Sure.
A lot of people, it was meant to be a tourist spot, but maybe perhaps people, it's a bit of a no-go area, she said, these days. Are these sort of areas areas that should be pinpointed in terms of? I think
we do. I mean, the guards do go along the boardwalk and into areas where they have intelligence in terms of knowing where problematic drug use occurs. Outreach teams do go down, engage with people, encourage people to come into services and treatment. Targeting how we the areas is very important. So it is ongoing. I go on the boardwalk a lot myself. I work nearby. Sometimes I do see intimidating behaviour. Sometimes, but very rarely, to be honest. It's not as often as bad as people might think. I'd encourage people to go to the boardwalk.
Okay. And I know you're taking part then in this Better City for All initiative. You're going to be discussing a lot of issues tomorrow, and maybe if you just want to, that's going to be looking as well at bringing in the whole overall drug strategy, is it? Sure.
Sure. It's the Better City for All initiative has been something that's been ongoing for around 5 or 6 years, and in recent times we haven't met up for some time. So there's a seminar tomorrow, and it's bringing together service providers from Dublin City Centre who the idea is to get everyone together, get those networks reinvigorated, look at some of the solutions, what's happening, because there are actually very creative and innovative things happening in the city centre that people may not be aware of, and we just want to make sure that we share information, get those connections going, if they're lacking, and make sure that we're working for the best interest of people who are really very, very vulnerable on our streets.